And just a quick overview of the presentation. So first I'll be defining stress and talking about the mind-body connection. Then I'll be talking about some symptoms of prolonged stress, depression, and anxiety. I'll then be discussing factors that are increasing stress, anxiety, and depression presently. And then finally, we'll be talking about some strategies we can all utilize to care for our mental health. So let's talk about what stress is. So stress is just the body's way of reacting to changes in the environment. And there are two different kinds of stress. So there's eustress, which is good stress, and that might be, in the extreme case, winning the lottery, in just everyday cases, having a baby or moving. And then there's distress, which is oftentimes when we think about stress, we think about distress, which is the bad stress. And that involves mental strain and tension. It may be caused by having a difficult job or boss and certain health conditions. And stress is not necessarily a bad thing and can be effective in a lot of situations. There's an optimal amount of stress that's needed to perform well in situations. And if you see on this graphic here in the yellow, that's where the optimum amount of stress would be. So for instance, if I wasn't stressed at all about the presentation today, I would have too little stress and would be in the green area there. And then there'd be really little engagement in the test. So I might not prepare for it. I would just be way too laid back to be able to exert effort. But then when we have too much stress in the orange and red areas, then that can lead to fatigue, exhaustion, and in extreme cases, anxiety or burnout. And we'll talk about those in a minute. So when we're faced with an acute stress situation, our body initiates the fight or flight response, which releases stress hormones into our body. And as I mentioned, that can be really adaptive in certain situations. So for instance, if there was a tiger in the room right now, it would be adaptive for my body to go into the fight or flight response. But with anxiety, oftentimes our mind creates the situation with the tiger when there isn't a real threat there. And when we're in a chronic state of fight or flight, which prolonged stress can do to us, it can start to impact the physical body. So now I wanted to spend a little bit of time talking about how the mind and body are interconnected. So research has demonstrated this bi-directional relationship between the mind and the body. So what happens in the mind also impacts the physical body. And as a health psychologist, I've seen this firsthand, where many mental health conditions can be expressed as physical ailments. And one example of this is in stress-induced cardiomyopathy, otherwise known as broken heart syndrome. It's caused by an acute stress or trauma where there's actual dysfunction in the heart, but it's caused by psychological factors. Another example of this is pseudo seizures, where again, it's related to having an acute stress or trauma reaction in their life, and the individual may exhibit seizure-like behavior. So there may be convulsing, loss of consciousness, but when tests are run, there's no seizure activity in the brain. Factors such as stress and anxiety can also impact existing physical health conditions. So individuals who have chronic pain, so someone might have a herniated disc, which is causing chronic pain, but mental health conditions such as anxiety and stress and depression may exacerbate the experience of pain. And factors such as stress and anxiety can also impact the onset of certain health conditions and also the maintenance of certain health conditions. So with heart disease, asthma, obesity, diabetes, migraines are a huge one that are impacted by stress. Certain GI issues, so IBS, also impacted by anxiety and stress. And it can lead to even Alzheimer's disease, accelerated aging, or even premature death. So all that is to say that mental health is health. And as Ali talked about in the introduction, oftentimes there's stigma associated with mental health in society at large, and especially in our Muslim community. And if we neglect our mental health, we risk jeopardizing our quality of life. and predisposing ourselves to physical health ailments, as I mentioned in the previous slide. And especially with the tragedy that we recently witnessed in Texas involving two brothers who were struggling with depression for many years, this sheds light on the importance of being attuned to our mental health. And in the next few slides, I'll present some symptoms of stress, anxiety, and depression so we can be aware of these signs in ourselves and also in those around us. So some signs of stress include fear and worry, changes in appetite, so eating more or eating less, difficulty sleeping, so difficulties falling asleep or difficulty staying asleep, challenges focusing on the task at hand, or worsening of existing mental health conditions. So if we have anxiety or depression or an existing mental health condition, stress can worsen some of those mental health issues. And as you can see, the symptoms of anxiety and panic may overlap with those of stress, but they tend to be a lot more pervasive. They include both physiological and cognitive symptoms. And anxiety is best described by worrying, so constant worrying about all kinds of things. And there are many different types of anxiety, and due to the scope of this presentation, I won't go into all of those, but these are just some general symptoms of anxiety and panic. And the symptoms of depression, again, some of these may overlap with symptoms of anxiety, but the hallmark sign of depression is sadness and feeling down. It's pessimism about the world. And I wanted to clarify that when we diagnose someone with, for instance, major depressive disorder, this is different from everyday sadness. So it's not like having a bad day. The symptoms have to last at least 2 weeks and cause significant impairment in one's functioning. So now let's talk about some factors that are increasing our predisposition to stress, anxiety, and depression presently. So if anyone has turned on their computer, looked at their smartphone recently, watched the news, we're just being bombarded with all of this negative news, and rightfully so. We're in the middle of a global pandemic, but that can definitely lead to a lot of stress and anxiety. And I wanted to take a few minutes to talk about some of the specific stressors we're facing right now. So uncertainty is an overarching stressor that we're dealing with right now. And it weaves into all these other stressors. So there's uncertainty about the pandemic itself. So when will it end? What will life look like in a month, in a year? What about important events? Will they be canceled, rescheduled? Will someone I know or care about contract COVID? Will I myself contract COVID? There's been a lot of uncertainty. Although there's vaccination efforts, there's been a lot of uncertainty with new variants. How long will the vaccine be effective? How long will we have to wear masks? So, this whole year has just been characterized by great uncertainty. The next one is lack of accessibility to healthcare or barriers to accessing healthcare. So those with health conditions such as cancer or diabetes, which require frequent management, have not been able to attend appointments because of fears of becoming ill with the virus. Also, routine visits have been delayed. Pains and concerns that may have come up during the pandemic, people haven't gone to check them out because they're afraid of going to the doctor or going to the hospital. Also, mental health appointments, someone who may be struggling with depression and anxiety may not want to do a telehealth or video visit. Those in crisis might not want to go to the ER. The next one, social isolation, has been huge for us all, but not being able to see family, friends in the community, or being able to see people as we'd like. And of course, things are changing as more people get vaccinated, but if your family lives in another state, there's a lot more thinking and planning involved before getting on a plane right now. A lot of us are working from home, partially or completely, and so that remote working can lead to social isolation. Then a huge one has been illness and death. So some individuals who are in attendance today may have contracted COVID. Some of us have had close family and friends who have been inflicted, and we've lost some of our community members to this virus. Some of us may be coping with the after effects, the physiological after effects of the virus, while others are grieving those who have passed. And even just vicariously hearing about the death toll from this virus can impact our stress levels. And there have definitely been huge changes in our routines. As we embark on another Ramadan, we spent all of our last Ramadan in isolation without Tarawih prayers or community iftars. Some of us have gone a year now without entering a masjid. Many individuals who valued their daily routines, such as going to the grocery store, running errands, haven't been able to do that due to concerns about safety. And some people have experienced loss of independence because they may have had to ask other people, such as their children or other supports, to engage in some of these tasks for them. And now as more individuals get vaccinated, there's also the stress and anxiety of re-entry into the world. So which activities do I feel comfortable with? Navigating relationships with others. Some of you may have seen this graphic that lists the risk associated with different activities, but of course, again, with vaccination, that's changing. Choosing to attend an event or not. If you are attending an event, trying to think about whether masks will people be wearing masks or not? So there's a lot more for us to think about, even engaging socially, than there was before. And Allah subhanahu wa ta'ala says in the Quran that we'll all be tested, and this is a universal test for all of us. And while we continue to have patience, we can also utilize strategies to positively cope with some of these challenges. So the first thing in managing stress might be limiting information. So although it's important to be aware of what's going on, sometimes it's also important to take breaks from news and social media. The other thing is to only access information from reputable sources. So there's a lot of fake news out there on vaccines, on the pandemic itself. And so making sure that when you are accessing that information, that it's only from those reputable sources. This one may be harder since, as I mentioned, a lot of us have had more social isolation and haven't been able to engage in a lot of activities. But having conversation with others that are not about the pandemic, and this was especially harder earlier on in the pandemic for individuals to talk about things that were not related to the number of cases or what was going on in terms of the pandemic. But I think even just sharing jokes with people, talking about things that are completely outside of the pandemic. I think most of us, including myself, have been guilty of, in the past year, spending excessive amounts of time on our phones. And on one hand, our phones have been a lifeline for us, especially as we've been dealing with social isolation. It's been the one way we've been able to connect with others, but sometimes it's good to just put the phone away because we might end up scrolling on social media or accessing the news if we are using our phone. And then, as I mentioned, with the mind-body connection, it's really important in terms of managing our emotional health to take care of our physical health as well. So this triangle that is visualized here is Maslow's hierarchy of needs. And at the bottom of the triangle are our basic physiological needs. So just food, water, warmth, and rest. And if we don't have those needs met, it's really hard for us to try to meet some of those higher needs. So oftentimes when patients come in to see me, one of the things I'll ask them is, How are you getting enough sleep? How's your appetite? I'll encourage, especially individuals dealing with depression, for them to get on a regular routine, making sure that they're getting 8 hours of sleep, that they're eating regularly throughout the day. Exercise is huge, even just going for a walk. And then taking all medication as prescribed, not just psychological or psychotropic medication, but also just their general medication that they're taking. And as I mentioned earlier, attending to their physical health concerns. So having regular checkups with the doctor. So all these things are very important in terms of managing our emotional health as well. I mentioned that all of us, to some degree, have been dealing with social isolation in the past year. And loneliness is linked to a lot of negative health effects, both physical and emotional. Some of the physical effects of loneliness include elevated blood pressure, increased risk for heart disease, and reduced sleep. And some of the emotional impacts of loneliness include increased depression, negative quality of life, suicide risk, and worsening cognition. So how do we manage some of that loneliness or social isolation that we're experiencing? Spending quality time with our family. So the people who live in our household, making sure that we're not just inhabiting the same space, but that we're doing things together. Contributing, so volunteering or acts of kindness can be really helpful. So that can be as simple as sending a message to somebody that you haven't talked to in a long time and telling them how much they mean to you. It can be making food for someone and dropping it off. There are virtual ways to volunteer. And there was a recent study in monkeys where monkeys who groomed other monkeys more, were less stressed than those who were receiving grooming. So again, points to the impact of just volunteering and contributing. Connecting through technology when we can't connect with others face to face. So I know I mentioned earlier, reducing our time on technology, but being more mindful of how we're utilizing technology. So technology can be helpful when we're trying to connect with others. For instance, we're all here together on Zoom, using FaceTime to talk with family members. And I think one of the positive things of the pandemic has been that people have been connecting more with individuals who they haven't talked to in a long time, or typically with our busy lives, we wouldn't have time to talk with, and people connecting all over the world. Going for a walk. So even just going for a walk in your neighborhood, you may encounter neighbors and other people, and helps you feel like you're part of something bigger and aren't alone. So on the next two slides, I've listed some cognitive distortions, which are basically errors in the way that we're thinking about a situation. So we may not be able to change the situation, but we can change how we view the situation and how we think about it. So I wanted to give an example. So for the first one, with all or nothing thinking, it can be looking at things in absolute terms, so black and white categories. And an example of that is someone who says, I haven't been able to go to the masjid for Jummah, so that must mean I'm not a good Muslim. And a way to reframe that thought is, I can pray at home because that's an acceptable form of ibadah during this pandemic. Another one, a lot of times when people are feeling depressed, they might exhibit a learned helplessness style. So they might think, well, if it's Allah's will for me to get sick, what's the point of masks or social distancing? And instead, what we can reframe that to is, there are factors that are within my control, and I can leave the rest up to Allah subhanahu wa ta'ala. And so with personalization and blame, someone who contracts COVID might think, this was a punishment from Allah for something I've done wrong. And a way to reframe that may be that all good and bad things come from Allah subhanahu wa ta'ala. And there are things that we may not have immediate rationale or reasoning for, but trusting that Allah subhanahu wa ta'ala trusting in his wisdom. And so when we're talking about reframing our thinking and shifting our focus, I know I demonstrated a lot of negative news articles that we're exposed to. But if we look a little bit harder, there are lots of positive news articles coming in recently as well, especially with vaccine efficacy, how many people are receiving the vaccine, that cases are going down, schools are preparing to reopen. So there is a lot of positive news out there. We just have to shift our focus to look at that rather than dwelling on just the negatives. And then some other ways we can focus on our emotional and spiritual health. One huge way is mindfulness, which a lot of times people confuse mindfulness with meditation, where mindfulness is just being in the present moment and being attuned to what's going on right now, and just bringing our attention to the present and doing one thing at a time. So not multitasking, not trying to do multiple things at once. And ways to practice mindfulness can be really simple. So even just washing the dishes, being attuned to that one task. So listening to the water running, feeling the water on your hands, being attuned to every step along the way. Same thing with making coffee or going for a walk and focusing on all the different things you see. You can also engage in mindfulness meditation practice, and there are a lot of behaviors or religious practices within Islam that we can utilize to practice mindfulness. So with engaging in salah, one of the main goals of that is to be attuned to the words that we're saying, the actions that we're engaging in, and making sure that our mind is not wandering while we're praying salah. And if it does wander, to bring it back or bring our attention back. Dhikr can be another form of mindfulness, reading Quran or listening to the recitation of the Quran. And then that brings us to religious coping. So just even having faith in Allah subhanahu wa ta'ala, that there's a higher power looking out for us. All of those aforementioned strategies like salah, dhikr, making dua, asking for Allah's help, and then utilizing other forms of organized religion. So utilizing the community, so virtual events such as this, and being able to utilize that Muslim community for social support as well. And then setting healthy boundaries, that can be with work, with our relationships, with our family, and with ourselves, realizing that we just can't do everything, and that's okay. The next one is engaging in deep breathing. So oftentimes when I instruct my patients to do this, I'll have them put their hand on their belly, breathe in through their nose and count to 5, and breathe out slowly through their mouth and count to 7. And an image you can keep in your mind while doing this is imagining a balloon blowing up. So imagine that it's blowing up as you're breathing in. And then when you release, imagine that you let it go and it slowly falls to the ground. And the last one is practicing self-compassion, which again goes along with setting healthy boundaries. When you can't get everything done or you don't do everything right, being able to be compassionate with yourself and extending the same level of compassion that you would to others. And there are many Quranic verses that can bring us peace. Just reading the translation of those verses can be helpful. And it's also important to remember that when we make dua, it's not like a magical wish. Sometimes it's not granted immediately. And it doesn't mean that if it isn't, Allah subhanahu wa ta'ala is not listening. Allah subhanahu wa ta'ala reminds us to be patient and steadfast when dealing with adversity. And it's also important to ask for help and recognize when we need help. And we have different types of support for different types of issues. So if we're looking for spiritual support, we have our MCC Imam, Sheikh Ibrahim, to go to. And As Ali mentioned earlier, there are counseling services that offer through MCC that offer free mental health support. And then there's professional psychological services. And again, that doesn't mean that the problem has gone too far where we're needing to seek psychological services. Psychological services can be preventative as well. And oftentimes people don't know where to start when asking for help. And I think a good first line may be your primary care physician. So to ask them for a referral for a psychologist or a counselor if needed. And then there are lots of free hotlines out there, especially for that in the moment support. And I wanted to leave it open at this time for any questions that came up throughout the presentation.
Jazakallah. This is a great opportunity for those that would like to ask Dr. Farka any questions that they'd like. One that came up from Sister Dilnaz was, first, she was thankful of kind of, everything that you've gone through, and then just asked more about some research that's been done on breathing and how it affects our mental health. And if you can share some breathing techniques, and I think, you did share that one with the visualization of the balloon, and then kind of more importantly and lastly, like, how can we implement these breathing techniques into our daily life?
Definitely. So the research on breathing and how it affects mental health, it definitely has a positive impact on anxiety. And it also has physiological impacts on our body. So as we're engaging in deep breathing, it actually slows down the heart rate, so allowing more oxygen into our body. And that can definitely help in those acute anxiety situations. In terms of incorporating, I would expand and not only talk about breathing, but just incorporating mindfulness into our daily lives. As I mentioned, we're very fortunate that we get to practice this 5 times a day when we're doing salah. That's a natural form of mindfulness that's embedded in our daily lives. I think if we're talking about maybe non-religious forms of mindfulness, like I mentioned, just in everyday practice, when we notice that our mind is drifting off, a lot of times we require mindfulness because we may be caught in thoughts about the future or thoughts about the past or lots of worries that may be going on in our minds. So when we notice ourselves kind of drifting off, kind of reshifting that focus and being attuned to what's going on right now, there are a lot of mindfulness apps out there as well. So there's Headspace, there's the Calm app, and they can provide a little bit more structure in terms of learning mindfulness. One strategy might be just to kind of sit in the quiet and watch your thoughts go by as if they're clouds. But even if you look on YouTube and look up mindfulness meditation, there may be a lot of videos that can help guide you through this.
Yeah, I think that's actually great. Really, the prayers that we have 5 times a day, and that reminder of how we can incorporate our religion into mindfulness as well as breathing is such a great call out, and one that I think has so much more power to our everyday that can be utilized in more creative ways, not just our spiritual health, but paired with our mental health as well. So as you guys have questions, you can put them into the chat, or if you feel comfortable enough to go on off mute, you can ask within this time period as well.
Assalamu alaikum, this is Khadija. I have a quick question for Dr. Sheikh. Just if you can elaborate a little bit about how do you recognize if your anxiety has reached a level that you should reach out for help? Like, what's that threshold, or what does that mean? Like, because it builds up slowly, and you never know what your normal is, or if you're out of that range.
Definitely. So I would say the big factor is how much it's impacting your quality of life. If you notice that it's getting in the way of you doing things, right? it's impacting your focus and attention. It's becoming so problematic that you're having a challenging time getting things done for work, or you're forgetting things, that it's impacting the quality time that you have with your family. I think those are all telltale signs that it may be, just getting out of hand, or like how pervasive it is, right? Are you worrying only when there's an acute stressor, or does it feel like it's an everyday thing? And as I mentioned earlier, with therapy, I feel like therapy can be preventative as well. So it's hard to say that it needs to reach this threshold for therapy to be the answer. But I think one thing to check in with ourselves, like I said, is how is this impacting? How much is this impacting my daily life?
Excellent point. I think there's not enough importance that's put on just using therapy as not just a means when it's after or during a episode, but preventative, being able to use it as an asset or an aid. There's some folks that use therapy just as a medium to be able to collect their own thoughts and to be able to bounce it off of a wall, if you will, that find benefit in just being able to use therapy in that fashion to reorganize their week. And so, I think that part, and Sister Khadija asking of really why, when is that time that we should seek it when our anxiety is peaking? It's such a important thing to be self-aware and to understand what is my everyday anxiety like, and when am I off balance, to even start to understand, is my anxiety getting to that heightened point? I think such a great question. Do we have others that would like to ask? Okay, I'll ask you one, Dr. Fika. I know one of the things that in our community we tend to have often is not just the stigma of seeking counseling or being able to see a therapist, but the added fact of, once I do, to pay for a service and to be able to see it through till the end. What have you seen as kind of methods that have helped assist our community in this kind of stigmatized seeking of help, and that has helped them get through this and get on to the other side?
No, I think the slide that I think I can't stress enough, that slide that says mental health is health. And I think that's one of the, as I mentioned in my final slide with, how to access help and entry. I think what's helped the most, especially for me working in a hospital setting, a lot of my referrals come from the primary care provider or specialist. And I think a lot of times when that individual is stressing the importance of this to someone during their annual health exam, it can really be helpful and kind of bridge that connection. I think when people think of it as, the same way that you would go to a doctor's appointment, when you're not feeling well, it's the same kind of care that you're accessing, and insurance can cover it. I think that sometimes demystifies the process for them.
Awesome. Thank you. Are there others that would like to ask at this time?
Yeah, Assalamu alaikum, this is Akhtar Sadiq. As far as for the seniors, Sister Fayaka, what do you see in current situations? What kind of stress they are going through, and what would be the remedy, for that?
Walaikum assalam, and definitely for the seniors, as I mentioned, that social isolation has been so huge, especially with seniors being at increased risk for severe effects of COVID. We know that the risk increases with age. I think that's been really challenging for a lot of people. You know, many people spent a long time not seeing their family members or being, you know, just not being able to hug their grandkids, you know, having a lot of those challenges and just, you know, especially like I mentioned, especially if you're retired. And I know people who are retired who their primary means of getting out was going to the masjid, with masjids being closed. That was really challenging. And I think all of those served as, you know, just huge barriers to just support that we typically would have in our lives, and especially for seniors. And I think the remedy for that, I mean, as I mentioned, the vaccine is making it easier for people to see their families. And as more people get vaccinated, that is just naturally remedying the situation. But I think staying connected as much as possible, I think throughout this time, a lot of people, a lot of even seniors have learned how to access technology like Zoom and FaceTime, and have been able to connect with others in the community and their family in that way. And I think that definitely serves as a remedy.
All right, I'll give it another minute. If there's any other questions, please ask them. Otherwise, we'll try to begin our wrap up. Okay. And if anyone does have a question they still want to ask, please do so. But I really wanted to take an opportunity to thank you, Dr. Faika, for spending your evening with us and providing the education that our community so direly needs, and is something that, you know, will get up on YouTube and we'll have more that benefit from it. But this is something that is been on a lot of folks' minds, and, you know, it's something that is important for us to be able to spend time and do so. We want to thank you for that. Alhamdulillah, it was a great privilege to have you and an honor to be able to go through all this with you. And inshallah, we'll begin to have more programs. We'll try to pull you into some more of them so that we can have your expertise a little bit more regularly. And, you know, just something to note is, as you all are out there in the community and you run into folks that are in need of counseling and services, our masjid does offer some, alhamdulillah, through partnerships with the youth committee and seniors committee. The counseling community does do a lot to try to pair up these needs, and we refer out to other organizations as, you know, the need is something beyond our capacity. So, you know, please reach out to the organization as things come up and as folks are in need of it. We have an email set up at counseling@mccchicago.org that can be utilized or referred for people to access. But thank you to Dr. Faika and to everyone that joined us this evening, spending your time on the importance of mental health education. Jazakallahu khair, and inshallah we'll talk to you all soon.
Thank you so much for having me. And it was a pleasure to see so many people from the community here.
Alhamdulillah. All right, well then, we'll close off the evening. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam.